Hi there, John FARAHMAND from Balanced Physical Therapy and Human Performance Center coming at you today with a little talk that was prompted by a discussion I had this morning with one of our clinical directors who just came through surgery. Now, before I get into the details of that conversation, I want to tell you what the talk is about today. It's about the 5 basic human needs. Each and every one of us has 5 basic human needs. Every human being on the planet has these needs, and I want to talk to you from the perspective of a physical therapist as to why they're important. 1 is air. 2, water. 3, food. 4, shelter. And 5, human connection. The ability to connect with one another on a special one-to-one level. I call it a co-created intimate space when I'm in an exam room with a patient. If it's a friendship, if it's an intimate relationship, partnership, human connection. Anyway, the conversation started this morning like this. One of our senior therapists, who happens to be our residency director, had some surgery for a deviated septum and was explaining to me the massive difference that he felt immediately when the surgeon pulled out the gauze. And he said, you know, my sleep, my energy, I feel like a Ferrari right now. It's unbelievable what a difference it made. And it got me thinking, as therapists, are we really giving enough thought to the whole picture of our patient? Because if I'm choking you right now, you don't care how thirsty you are. And if you're dehydrated right now, you don't care how hungry you are. And et cetera, in that order of the hierarchical human needs. If our patients aren't breathing well, how's that affecting the rest of their physiology? If their O2 sats are in the toilet and we're not measuring, or we're not aware of that, how's their exercise capacity? Or if they're not getting adequate nutrition, how's that affecting their sleep? Or if they're dehydrated, maybe they're eating way more than they should, and that's why they're overweight, because they're trying to hydrate themselves with food because they're not drinking enough water, et cetera. If they're lonely, okay, how's that affecting their posture? Or if they just have excessive thoracic kyphosis, you know, how's that affecting their breathing and therefore their O2 saturation levels and therefore their energy levels and therefore their capacity to exercise? And what it got me thinking about during this cool conversation with one of our senior therapists this morning was, are we as therapists actually looking at and considering the entire person, each and every encounter we have with them? How did they sleep last night? Okay? Did they eat breakfast this morning? If we've got a really heavy exercise day today for our athletic patient who's post-surgical, maybe, 3 months out post-ACL reconstruction, and we're planning on slaughtering them in the gym today, did they eat? Did they sleep well? Are they hydrated? And are they going to be able to commit to the plan that we have laid out for them today? And then the conversation morphed into, this is why our orthopedic residency is so important. Because when you're around senior clinicians and when you're around people that have years of experience treating patients, these are the kinds of nuanced things that you can pick up and remember to ask patients and think about how the entire picture of that human being is going to play out with their rehabilitation course or not. And maybe how you can fill in the gaps for them and coach them out of bad patterns that they're not even aware that they're caught in. So 5 basic human needs are very important for your patient outcomes, okay? It may sound funny, it may sound quirky, but just think about it with a clinical eye and with a clinical mind, okay? Air, first, water, food, shelter, and human connection. Think about how those 5 basic human needs might impact your clinical care if your patient is deficient in one or more of those areas that they may or may not even be aware of, and more importantly for us as clinicians, that we may not even be aware of unless we're paying very close attention to them as human beings. We're listening actively, we're taking an interest in them outside of their clinical diagnosis, and we're paying attention. Thank you all very much for listening. As a physical therapist, this message is extremely important to me, but as a human being, it's even more important to me. I hope this resonates with you, and I hope you like it and share your comments. Thanks so much for listening.